Here's a normal brain without ADHD. Here is one with it. Notice the smaller prefrontal cortex and cerebellum. These can lead to a lack of focus and irritability, hallmark symptoms of attention deficit hyperactive disorder. With about 1/10 of children and young adults suffering with ADHD, treatment for the disorder has become very popular. Stimulants are the gold standard medication treatment, but they come with a lot of side effects. Something that has been gaining popularity recently is l-tyrosine, an amino acid that people claim can help with ADHD. In this video, we'll take a look at the studies done on l-tyrosine and if it's a good, natural alternative to prescription stimulants. First, let's understand what is the cause of ADHD. Genetics play a big role in developing ADHD, but environmental factors are a part as well. The neurotransmitters dopamine, norepinephrine, and epinephrine play a huge role as well. From this figure, we can see that there are 3 different ways that a neurotransmitter may fail to do its job. 1. The sending neuron may not release enough neurotransmitters. 2. The receiving neuron may have trouble catching the neurotransmitters. 3. The sending neurons may suck the neurotransmitters back up too quickly before the receiving neuron can catch them. ADHD is prevalent in about 10% of children and young adults and is characterized by difficulties with attention and/or hyperactivity and impulsivity. Inattentive symptoms include careless mistakes, not listening, being easily distracted, and hyperactive or impulsive symptoms may include fidgeting or getting up often, things of that nature. Having both inattentive and hyperactive symptoms is very common. Like I said earlier, stimulants like Adderall and Ritalin are the most commonly prescribed medications used for the treatment of ADHD, but l-tyrosine is becoming increasingly more popular. L-tyrosine is a non-essential amino acid and can be found in foods like cheese and dairy, turkey, beans, eggs, chicken, and peanuts. It's a precursor to dopamine. From this figure, we can see that tyrosine turns into L-dopa, which turns into dopamine, then norepinephrine, then epinephrine. These are the same neurotransmitters I mentioned earlier, and they are important for focus, motivation, energy, stress, mood, things like that. There is a blood test you can take to measure tyrosine levels, but it's not commonly used, and also majority of people are not tyrosine deficient, so we're not going to focus on the blood test too much. The reasons people like to use tyrosine is to try and boost cognition and alertness under stress and improve mood, but let's look at some studies to see if that is actually the case. This study found that 8 out of 12 participants initially had improved attention deficit disorder over 2 weeks, but after 6 weeks developed tolerance to the treatment and their improvement stalled. This is the main study that people hold on to when they are shouting the benefits of l-tyrosine. 2 weeks of it working, and after 6 weeks developing tolerance, and at 8 weeks going back to your original symptoms and feelings. Not great results. Also, a very small study, only 12 participants, and the dose used was 50 to 150 milligrams per kilogram per day, which is about 2 to 7 grams of l-tyrosine a day for a 68 kilogram or 150 pound person. Let's look at more studies. This study found no benefit to 7 children with ADHD. These 2 studies found that l-tyrosine did not improve mood or behavior in healthy people under normal conditions. Experts previously thought that lower tyrosine levels in the body may be responsible for ADHD symptoms, but a study from 2016 showed that most people with ADHD have normal levels of tyrosine in the blood, which is pretty much what I just mentioned earlier regarding the blood testing. And this study from 2011 showed that tyrosine and 5-HTP can help with ADHD symptoms, but this study was later retracted, so the results are basically nothing. This study found no evidence that tyrosine had any antidepressant activity. And now I just want to quickly compare tyrosine to Adderall so we can see the differences in terms of efficacy and side effects. 6 studies of 384 children were included. All randomized controlled trials found that Adderall improved all measures versus placebo. Looking at this graph, we can see that ADHD rating scale was significantly lower for the group taking Adderall than the group taking placebo. Also, from this table, we can see better scores all across the way for those taking Adderall. However, those benefits don't come without risk. We also see a much higher percentage of insomnia, loss of appetite, anxiety, headache, and agitation when taking Adderall compared to placebo. Now, there is talk that l-tyrosine can be combined with Adderall to reduce side effects. I'm currently not aware of any studies that would show that this makes any difference. It may work on an individual basis if people want to try it, but definitely not enough evidence or basically any evidence to recommend this supplement in general for people struggling with side effects from stimulants like Adderall. So, l-tyrosine for ADHD, worth the hype? L-tyrosine on a daily basis, probably not beneficial. We don't have a specific study we can point to and say this shows promise for L-tyrosine. And to make things worse, we don't even have an effective dose. Doses range from 500 milligrams all the way up to 7 grams, which is a huge range. We saw from the studies that it won't help with ADHD symptoms and it won't help reduce Adderall side effects. It can possibly help for an immediate effect, like taking it right before an exam when under stress, which is kind of what we saw from the longer study, that the effects died out and people became tolerant after a few weeks. So short-term use may be useful, but no conclusive data here. At this time, I would not be taking L-tyrosine until better data has come out. Thanks for watching.